Welcome to Friday Focus, February 26th, 2016. We're going to talk about something we talked about last week. I kind of want to reinforce it. We're going to really look at different metrics that gauge our growth. And one key one, obviously, is new patients, number of new patients. And the other thing is our production. So production is, what your bonus and super bonus is based on. And then your new patients are the metric that drives that up or not. If we had to survive on existing patients, we have some Botox like that, stuff like that going on, but like the vein business would dry out and the surgery business would dry out. So we had to keep replenishing with new patients, even for dermatology, which is a revisit business. And that's one metric that we've been kind of struggling with. We have 5 locations. We're looking to open a 6th one soon. And the different providers, different medical assistants, different locations, different times of day, we have varying rates of converting consults into patients. And again, we can't deliver customer care unless we make them patients. And one thing that's true is that when you measure things, they're more likely to occur because it kind of reminds you that these things have to be done. Whereas if we just say, let's just see how it goes at the end of the day and see how we did, we can't really maybe get the same production than if we are deliberate and plan for success. So we're in plan for success. So last week in Tuesday's meeting, we talked about I want to know the outcomes of every consult. We talked about some other things too. I think I got it too complex. We're going to go to consults. A consult could be an existing patient, it could be a vein patient that's getting a cosmetic consult, or it could be a new patient. Okay, so we're going to track the outcomes of consults. The easiest way to measure them is by looking on your next tech and seeing where the new patients are at, but then you're going to have some added on from that say some didn't come in and some got converted from another department. Now we have these sheets here. There's a vein consult, the mapping report, and by location. And there is a cosmetic consult by location. And Maggie's going to put these in the computer so you can access them and fill them out. I want these filled out more or less on a live basis. You can fill them up by hand and then upload them. We're going to have an electronic version coming very soon. So let's take the vein consult and mapping report. There's some data we want because by getting the data, we can measure where we're having problems at and address them. It might be additional training, it might be the time of day, it might be inadequate resources. So we're going to have their name of the patient, type of appointment. So on vein, so is it a map or is it a screen, which we call, obviously, consults. We're going to list the name of the medical assistant, or it could be a tech who saw him as the consult, the provider. We're going to say, ask yes or no, did we map them the same day? So we mapped the patient the same day. Did we schedule mapping? So one of these should happen. So we should imagine that about 90% of the patients that come in for consult, one of those 2 should be filled out. That's a best practice. That's what we were able to achieve last month in certain offices. If they don't schedule, we want to know why. Okay, so why did they not schedule? Could be they're not a candidate. Could be they thought they had varicose veins and it was something else. Could be some other reason. Sometimes it's that we didn't offer them a mapping the same day. Did we convert them to another department? So did we cross them over to somewhere else? Okay, so those are the key metrics we're going to track on vein patients. Cosmetic consult is both surgical and non-surgical. We're going to ask them the same questions. Name. Are they a new patient or established patient? So if somebody comes in here for their Botox treatment and they're getting Botox, that's an established patient, but it doesn't go on this list. This list is for consults. Okay. What's their complaint? We call it complaint. It might be concern. So what is their concern? They have varicose veins. Who's the MA? And who's the provider? Did they get a signed quote? We've gotten really kind of a little sloppy with that, doing the quote. So now we're going to use the quote sheet like the Magic Lift, and we also have a generic quote sheet for the non-Magic Lift that you can fill out and have them sign it, and you can even make a copy for them. So you can do 2 quotes and give them a copy. But that goes in a chart, and then we're going to have somebody sort of after the fact enter it in electronically, so we have a copy of the contract or the quote. So the quote, you don't necessarily read to run the front desk or print it off. Just have them sign the Magic Lift quote or the other. Is the new quote sheet made yet? Okay, Mary has the other quote sheet for the non-mapping. So for let's say Cool Sculpt, we will have a quote that looks like the Magic Lift quote sheet. You have them sign that, and you can still write it in the quote sheet in the chart. Okay, so we're going to have a signature on the quote. Did they get same-day treatment? Yes or no? So Cool Sculpt consult comes in, and we can convert them same day. That's a yes. If not, you're going to put them under the rebook column. When did you rebook them for procedure? If you did no and no, we want to know the Why? Could be they're too heavy, they're not a candidate. Could be they're too skinny. I think I saw one about 3 years ago. She was too skinny and she was deflated. And nobody believed me. Sale size, the size of the sale, and then they convert to another department, okay? And we're gonna expect this on all new patients. And you know, really the value of the new patient is pretty enormous. It's what runs our business. So our new patient value has been sort of declining, value per new patient, since we've added doctors, providers, staff, and locations. Okay, and the reason is because we are getting busier, we're getting a little more sloppy with what we're doing for every patient. Okay, when I started this business, it was really me seeing everybody, and I knew exactly what was going on. I knew my costs, and I knew how much revenue we got per new patient. And now as we're expanding, we're sort of losing touch of that. It's almost like, you know, please send us more new patients. We'll try to convert the best of 10. But really, all 10 that came in wanted your services, so we should approach that 70, 80, 90%. On veins, we were able to achieve 90% conversion rate, 96% in Livonia last month of consults to mappings, 93 in Shelby. We had some offices that were around 50%. So it's not different people, it's the us, okay? In some cases, it might be lack of resources. Well, I don't know that unless we have these sheets filled out and I can see we didn't have a tech. Okay, sometimes it's our linear thinking. We have a patient that we want to get mapped. We have an EVLA coming up in a half an hour. You can map them. You can start the mapping. Tech can walk out, do the EVLA, takes 10 minutes, and finish the mapping. So you got to think about how you can utilize your time more effectively with our existing resources. That's another important thing, okay? But either way, we want this stuff answered very specifically. So far, different people in the office came up with different ways to do it. A lot of them were good. Some of them were kind of hard for me to read. So we took the ones that seemed pretty good and combined them. And I know Jessamy made the cosmetic one here. I really liked that because I can understand what the outcomes were. And we were doing really good in the Shelby office filling that out. And then yesterday, 2 days ago Wednesday, we kind of missed filling it out. You know, there's 2 people out of the 10 consults got filled out. So we're going to do this regularly. We're going to hold you accountable. You know, we talked before about, you know, engagement. Part of engagement is being accountable for doing your job, and this is part of the job. And I'm requiring this because I need to understand why our revenue per new patient is dropping and how we're going to fix it. And we're going to fix it by offering the patient the services that they came here for. So that's Friday Focus. Good luck. We're going to keep growing. Thank you.